At this time, our next panelist, as we're moving right along, is Dr. Eric J. Williams. And he'll be presenting on utilizing collaborative models to eliminate health disparities. And certainly, as a registered nurse myself, I really identify with the work that he's done and all the awards and accolades that he has and in the practice of nursing. Dr. Eric J. Williams is the Assistant Director and Faculty Leader and Professor of Nursing at Santa Monica College, Santa Monica, California. He is recognized as being the first African-American male faculty member where he began his appointment in 2001. And let us at this time receive Dr. Eric J. Williams.
Good morning.
Good morning.
And for the sake of time, I'm not going to repeat a lot that Ms. Dawson and Dr. Williams has already stated, because a lot of it was in my presentation as well. But I bring you greetings on behalf of the National Black Nurse Association, where we have over 90 chapters across the United States. And we represent over 150 African-American nurses. And this is very unique for me, and it's a sensitive moment, because 2 weeks ago I was installed as the president, first male of NBNA. And it was here in Cleveland that at the home of Dr. Mary Starks Harper, the late Dr. Harper, that a group of nurses came together from around the United States. And the motion was here in Cleveland. The motion was cast that the National Black Nurse Association be formed. It was here in Cleveland, Ohio. Also, I would like to acknowledge my colleagues that are here from the Cleveland Council Black Nurse Association. Would you please stand? Because some of our members have transitioned, like Maddie Etna and Jane Gray. And I would be remiss to say that I would like to acknowledge someone. She's not here, Dr. May Weichel. I stand on the shoulders of Dr. Weichel, who was very instrumental in me coming to case. When we talk about collaborative models, the research and the evidence has been presented that while we've made some advances in healthcare, we still lag behind regarding health and healthcare services and access for minorities and blacks. And here again, we need to think about this as a donut with a hole. There's a gap, and we need to begin to fill that gap and close that gap. And when you think about if you were to have a donut and some tea, when you think about making a hot cup of tea, there's an exchange that takes place with the tea bag. So we need to come together to join forces to make sure that we provide services that people need. And there are a lot of reports that we talked about, the Institute of Medicine report, reports from the CDC that talk about healthcare disparities and inequities. While we may not be able to eliminate healthcare disparities, it's important that we work together in a joint committed relationship where we eliminate inequities and promote health equities. When you think about behavioral risk factors, we know all of those things that for sexual activity, substance abuse, and the list just goes on and on and on. Environmental exposures. A lot of times when I'm at work, and I taught at Dillard for like 10 years, and when I moved to Los Angeles, a lot of times people, you don't talk about personal things in a work environment. And sometimes people say, well, are you an only child? And I say, no, I came from 9. Then they'll say, well, I said, no, I grew up in the hood, but I liked it. I always say I liked it. It was the only thing that I could relate to, okay? So you meet people where they are, but I would have to tell people that don't look like me, and I enjoy it where I grew up. I enjoy it when I go home. So we talk about all of these social determinants of health and things that we need to work to eradicate. When we talk about access to care, we need to make sure that we understand the impact of not having an education. When we talk about collaborative models and how we can come together to make sure that we create the next generation, okay? And that's very important, that we create the next generation of nurses and leaders in other disciplines, okay? And for me, I've had my 30th year basic preparation before I went back for my bachelor's nursing training. So when we think about creating the next generations, I was saying to some of my classmates, you know, we're over 50. We have more time behind us. We have to face the reality that once you have more time. Not many of us are going to make 100, okay? And then if you're 65, only 20% of people that are 65 are going to live to be 80. That's scary. So if you're 65, only 20% will live 15 more years. Okay? So we have work to do in creating the next generation of leaders that can take us where we need to be. We were having our NBNA Day on Capitol Hill, which the late Congressman Louis Stokes was very instrumental that the first Friday would be designated as National Black Nurses Day across the nation. The first Friday in February was NBNA Day. And he was very instrumental in that. And I came to NBNA as a student nurse around 1984. And I had a lot of mentors that was able to get me where I am today. When we talk about all of the social determinants of health and all of the problems that we face, we have to look at coming together for the common good. When we think about seeing healthcare, we need to see access as a major issue. We need to talk about safety. People are not safe in clinical settings anymore. At least 44,000 to 98,000 people are victims of unsafe procedures each year, which runs about $29 billion. We need to talk about timeliness when it comes to access of care. African Americans and minorities do not get same-day appointments. We don't get appointments the next day for our health care issues. So when we talk about patient-centered care, it's very important that, and I want to tie together collaborative models in a minute, because we all need to be looking at the same issues here. When we talk about patient-centered care, we need to see patient-centered care in the patient's eyes. We need to ask the patient, even if you're a pharmacist or social worker, what is it that I can do to make this situation better? What is it that I can do to relieve your pain and suffering? When I worked at Charity Hospital in New Orleans, I had to really learn very quickly. And my doctorate degree is in cultural competence. And now I'm saying that we need to move beyond cultural competence to cultural proficiency. We really have to move beyond that. Okay? So we need to understand each other. We need to make sure that other people understand each other. Now that I'm at, working, I loved when I was at Dillard, and I moved to LA, and the needs of patients in Baldwin Hills, where I live, or Beverly Hills, is different from Watts and Compton. And when we go into certain areas, we need to see the patient or the individual. We need to see the community as the patient. We need to ask people, what is it that you need? And not tell them what they need.
Right.
It's very, very easy to tell people what they need. So we need to see the care that the person needs in their eyes. And they will direct that. And when I was at Charity Hospital in New Orleans, I had to learn very quickly, I could not ask patients when I worked in the ER. And Charity Hospital was a very 18-floor hospital. We had 3 emergency rooms. And we had some difficult days 30 years ago because we didn't have all the things we have now. And if you wanted to get information, you couldn't say to a patient, do you use street drugs? Because you wouldn't get the information that you needed. I had to say, do you do a little crack or coke or weed to be sociable? And then they would say yes. And then they would say, do you? And I would say, no, I don't. And I would be triaging patients when they come in the door. Okay? So I had to learn very quickly. And I grew up all of my life And I had all of these things in nursing school, how to interact with people. And those things that we learn in college, we don't get to use all the time in a practice environment. And we need to work on helping people learn those soft skills, things that they do not teach you in a book.
That's right.
Okay? Because I didn't learn that in a book, how to interact with people that looked like me. It was very much from a scientific approach. So when we talk about coming together with other professionals, and I'm glad that Dr. May Weichel and all those people who mentored me along the way talked about the community, because we're moving in the public's domain. We have to make sure that we're very public, community-based, and we have to develop innovations and strategies to make sure that we're meeting the needs of people. That we, not only do we develop programs, that we look at strategic interventions and strategic evaluations to identify what's working and what's not working, so that we won't recreate things. So what can we do as in a collaborative model is we can come together, and when we come together, the first thing that we need is trust. We have to trust the knowledge of others and the skill sets and the expertise, because our patients come together and they require that we have trust in each other, and they require that we be trustworthy and we give them trust. Someone said to me, I was presenting and the person didn't look like me, and she wanted to know why African Americans did not trust regarding the healthcare system and the delivery that we do. And she began to talk about the Tuskegee study. And I had to stop her, and I said, well, half of the people under 50 don't know about that. I said, let me tell you why African Americans may not trust. We don't have to go 50 years back. It's what happened yesterday or this morning. So it's very important that we don't get this twisted. A lot of times people do not trust because what happened to them, their experiences that they bring along with them. So when we talk about collaboration and developing models that work, Ms. Dawson had a model there, and there's several models. In DNA, we developed a collaborative model years ago where we came together every 4 years with other professionals. And we called it the Black Congress on Health, Economics, and Law, because we saw all of these things coming together in effect to eliminate healthcare disparities. We know education is the key. We have to begin to educate people early. In elementary schools, without an education, we know what can happen. Both of my parents and grandparents didn't have an education. And when I happened to be in college, my grandmother said to me, the only thing you can do good by yourself. Okay, they will come to me and say, I don't, I know you're upset that I didn't do well. And I'm like, well, there's more. We have more tests coming along and so forth. So we have an obligation to educate each other to make sure that we create the future. And I tell students all the time when I go out to the historical black colleges and so forth, I was just down at another school, and I wasn't sure if this young nursing student was being bratty or got tired of hearing the distinguished lecture. And she began to thank me for my visionary leadership. She began to thank me for all of the things I had done in nursing. And I stopped her. And I said, the needs of the community and society, the needs have changed since I entered nursing school in the early 80s. And I stopped her to say, what are you going to do to make a difference in the lives of others? It wasn't about me, okay? You know, within 7, 8 years, I'm ready, retirement is coming near. But I want to know, how can you make a difference in the lives of the people that you serve? This is a 21-year-old student, and she's thanking me for the things I've done. And I'm like, we need to move beyond that. Let's get you to become a leader, because there's room to stand next to me. Okay? And leadership is like going dancing. You take one step, I take a step, and so forth. And I tell the students all the time, we need leaders, and to be a good leader, you have to be a follower.
That's right.
And if you don't decide to lead, then you need to be a good follower. And you need to be able to take orders well. And most of us don't like to do that. So when we think about collaboration, we need to come together to speak with one voice regarding advocacy. We need to advocate for what the person needs. Okay, we need to come together to make sure that we have programs that are effective. We know that we have an epidemic now. We've talked about diabetes, HIV, cancer, hepatitis C is on the rise among baby boomers. But we have a very serious epidemic now that we really need to address, and that is of violence. People are dying in violent situations more rapidly. And we know that violence is linked to mental health, poor impulse control. And we have the answers, we have the evidence. We know that violence is linked to a lack of strength in the family unit. In 1992, the National Black Nurses, we looked at strengthening the African American family as a strategy to reduce violence in African American communities. And I think we need to revisit that. Okay, how do we strengthen the family unit whereby, as I say, I come from a large family and I'm near the bottom, and some of the older siblings at a certain age, they wanted to do certain things and go certain places. But my parents, my mother, because my dad died at 52, but she demanded on Sunday we all sat around the table after church and passed the food. Now, during the week, you can go your separate way if you're 18, 19, but on Sunday, we had to come together to talk about certain things. So I think we need to go back to strengthening the African American family. Regarding violence in our communities, we have the answers regarding our youth. My grandmother used to invite people in the neighborhood, and she didn't care about what the parents did. But she would tell the parents on Sunday, let those children go to church with us. And where we lived, we could walk like 4 or 5 blocks to church. And she had like 12, 15 kids coming to church with us. We know that children who are incarcerated or get in trouble have no religious affiliation. We know that from research. When you find people that are incarcerated and you begin to talk about their relationship or their interconnectedness with a higher being, most of them don't have that. So therefore, they get into trouble and so forth and so on. So we need to connect with faith-based organizations to make sure that we have programs that will pull people in, whereby they can learn right from wrong and so forth. And even if people stray and they know right from wrong, they usually come back. We need to make sure that we have academic progression, lifelong learning for people in every discipline. Whether you're in pharmacy, social worker, PT, OT, the nurse, we need to make sure that people have advanced degrees so that we can create the next cadre of leaders. Because we can no longer say, I have mine, you have yours. So we need to create the next generation through education. We need to be the change agent. So we talk about collaboration. We need to talk to each other, come together, and make sure that we're the change agents that we want to see in the world. It takes a village, and to whom much is given, much is required. We have a lot of work to do. These are exciting times because we're able to verbally and blatantly and outright address the issues that we could not address 30, 40 years ago. We can be open. We can be transparent. We can say what people need. We have the voice. We have the people that are in strategic places that we can call. And I'll say this, when AIDS was in a major epidemic and policymakers were not hearing, I can recall being down at Charity Hospital, and I had this 2 politicians, congresspersons, that, and William Jefferson was one, that attended the same church I attended. And patients were outcast, families were afraid, they were homeless and so forth. And I asked these 2 politicians to give me 30 minutes. I said, I just need 30 minutes. Will you come to the hospital and talk to these patients? And they ended up staying 4 hours. When they heard the stories, one of them left and said, Eric, we need more money. We're going back and ask for more funding. And there was something as simple as saying that I needed more help. And that was only one sector of the devastation of the disease. And I can recall having a patient that the doctors were going to take to surgery, and the doctor said to me that he's not going to live, but we're going to take him to surgery anyway. And I called home, and I know we have HIPAA and all that, and I didn't give a name, but I called home and I said to my grandmother, I said that, you know, the doctors are going to take this man to surgery, and that he's not going to live anyway. And my grandmother was in her 80s at the time. She lived to be 102, outlived all of her children. And she said to me, well, Eric, let's see about that. I will call some of the warriors who have nothing to do with prayer. After this man did real well, my grandmother wanted to meet him. And the only thing she said to him is that I want you to come to the powerhouse where the prayers were prayed, at least once. And one of the persons that had prayed for him didn't know this man. And when she met him, she started crying. She said, I've seen a lot of miracles, but this was someone that the doctor said would not make it. And here am I being the nurse, and we could not mix the two, but I knew to make a phone call. I said, can you remember this person? So again, to whom is given, much is required. And the National Black Nurse Association, we're willing to stand with the Northeast Black Coalition. As I told Yanka, anything that I can do as the president to make sure that this works next year, even if it's making a donation on behalf of the Cleveland Council Black Nurse Association, we're here to support this initiative that's needed. And as I said here, I would say God bless America and God bless the Northeast Black Coalition. Thank you.